Hello everyone, this is Dr. Santhoshi Nandigam, consultant obstetrician and gynecologist, the Birthwave Holistic Wellness Clinic, Nungambakam, Chennai. Welcome to my YouTube channel. In the video, let us discuss about the different phases in a women's menstrual cycle. So, ஒரு menstrual cycle வந்து different phases இருக்கும், 4 phases இருக்கும் to be very honest. First one is the menstrual phase. So, in the menstrual phaseல வந்து ஒரு womanக்கு வந்து periods வரும். So, அந்த endometrium shed ஆகி period ரூபமா, bleeding ரூபமா வந்துரும். So, it can last anywhere between 3 days to about 8 days maximum. So, in the 3 to 8 days duration, a woman changes pads anywhere between 2 to 3 pads per day or sometimes even more. So, in the menstrual period, simultaneously, follicle develop agada, and that is why the menstrual period, along with a couple of days later, is called as a follicular phase. The first 14 days in a women's menstrual cycle, in which the menstruation is already included, is called as a follicular phase. So, in the follicular phase, a woman's estrogen is dominating because of this hormone called as follicle stimulating hormone. So, this follicle stimulating hormone in the follicle develop பண்றதுக்கு grow பண்றதுக்கு ரொம்ப முக்கியம். There are so many follicles that are developing, let's say for example 6 to 8 from both the ovaries. In the 6 to 8 follicles from both the ovaries, ஒரு follicle dominant grow ஆகும். It kind of uses all the necessary ingredients in the ovaries to grow dominantly and become the future egg. Next phase is the ovulation phase. So, and the dominant follicle nalla grow aanaporo after it attains a specific size, somewhere around 2.2 to 2.2 centimeters size ku varumbodhu, our body has the automatic mechanism to reduce the amount of FSH and reduce the amount of estrogen. So, in the duration la LH, that is luteinizing hormone, jaasti agu, and in the influence of luteinizing hormone, the egg, the dominant follicle, releases the egg from the ovaries to the fallopian tube, and this process is called as ovulation. So, ovulation mudichittukapparam, the uterus goes into a different phase which is dominated by luteinizing hormone and progesterone, and that is called as a secretory phase. So, the secretory phase helps in building the endometrium. So, if an egg release aichilliya, the dominant follicle and the egg release aicha. So, when we time intercourse along with ovulation, and when there is a sperm coming into the female reproductive tract, the sperm and the egg meet and fertilization happens in the fallopian tube. So, fertilization mudichittukapparam, whatever is formed, the embryo, the blastocyst that is formed, comes into the endometrium or the uterine lining, and it starts to implant itself into the uterine lining. So, implantation nadakradhukku, the endometrium has to be prepared, and that's exactly what progesterone does to the uterus. It builds up the endometrium, makes it receptive for the embryo to implant. So, secretory phase oda main vela endometrium build பண்றதுக்கு and the form ஆன pregnancy அந்த implantationக்கு ready பண்றது is the secretory phase oda vela. If at all there is no pregnancy happening or there is no sperm that is coming to the female reproductive tract or no fertilization happening, obviously the endometrium continues to build for some time under the influence of progesterone, which is now being released by corpus luteum and so on. So, dominant follicle and the egg vandirchilliya. So, the remnant of the dominant follicle becomes what is called as a corpus luteum. So, this corpus luteum releases progesterone that is essential to build the endometrial lining. Pregnancy nadakama pakshathila, this endometrium is going to shed after a couple of days because corpus luteum oda life it is hardly around 14 to 15 days. Within 15 days, the progesterone in the body comes down, the corpus luteum reduces its function, and we get periods if there is no pregnancy. Grossly, ஒரு women-ஓட menstrual cycle இந்த 4 phases-ல divide ஆகும். Menstruation, follicular phase, ovulation and secretory phase. Thank you very much.